Hello, I'm Dr. Owen Arthurs and I'm a paediatric radiologist at Great Ormond Street Hospital. I'm the clinical lead for post-mortem imaging. So the idea of post-mortem imaging has been around for about 20 years but only recently applied to children. And here at Great Ormond Street in the Institute of Child Health we've just finished the world's largest trial of 400 fetuses, stillbirths and children to show that post-mortem imaging, in particular MRI, is both diagnostically acceptable and also very acceptable to parents. So what we'd like to do next now, we're at the point of rolling out imaging as a clinical service across other NHS trusts, but there are several challenges that we face before we're able to do that. So here at GOSH we have a wide spectrum of both sizes of children and a number of diseases that we encounter. So one of the challenges is that we currently only have a visual qualitative assessment of some of the images that we acquire. So despite the advances that we've made in post-mortem imaging, one of the problems now that we have is still being able to differentiate, for instance, between whether the heart stopped first or the brain stopped first. And we think some of the quantitative measures that we have might now be able to address these. So my belief is that some of the techniques that Nick and David have been working on can really help us try and address these problems.
Hi, I'm David Carmichael and I'm a lecturer in neuroimaging and biophysics at the Institute of Child Health. What this project is going to involve is developing new pulse sequences that can accommodate the range of different values that we encounter in post-mortem imaging, and also accounting for temperature, which of course is different to in vivo studies, and doing that will allow us to compare the results we get to in vivo data that we have. Also, we want to take the data and develop analysis methods, for example using atlases which will allow us to compare between different brain regions and the quantitative values that we get within them when there's been a different cause of death.
Hello, I'm Nikolaus Weiskopf. I'm Head of Physics and Senior Lecturer at the Wellcome Trust Center for Neuroimaging at the Institute of Neurology at Green Square. At the center we are developing advanced neuroimaging techniques for neuroscience and neurological imaging. And one of the recent developments we have been working on is quantitative magnetic resonance imaging at very high resolution. Using these quantitative advanced imaging methods, we were actually able to show that we can detect, for example, myelination levels in the brain, and they are comparable with what people have found with invasive methods, for example, such methods as histology. We are developing these quantitative imaging methods further for in vivo histology, and for that, for example, we develop new pulse sequences, biophysical models, and to combine it and apply it and translate it into post-mortem imaging is a unique opportunity. We have already shown that the quantitative imaging methods we developed are providing data that are comparable across sites and time points, which is one of the prerequisites for standardization of clinical imaging, as we would need it, for example, for post-mortem imaging.
This project is uniquely possible at UCL because it brings together the clinical imaging service and the fact that Great Ormond Street is going to be performing of the order of several hundred post-mortem studies per year, along with the imaging expertise that's available at the Institute of Child Health and also the Wellcome Trust Center for Neuroimaging. Because this is a new area, it's really wide open for someone to come in and really make a difference.